2, 1.
Good afternoon and welcome to the Board of Health meeting of March 22nd, 2021. Please note this meeting is being recorded and will be available shortly hereafter for schedule on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's March 12, 2020 certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 18, and the Governor's March 15, 2020 strict limitations on the number of people that may gather in one place, this meeting of the Chatham Board of Health is being conducted via remote participation. No in-person attendance permitted. Effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. To listen to this meeting while in progress may do so by calling the phone number posted. That number is 1-508-4410, and the ID number is 668-948-813#. Despite our best efforts for real-time access, we will post a record of this meeting on the town's website as soon as possible. Now I would turn the meeting over to John Beckley.
Thank you, Judy. First thing I'd like to do is establish that we have Board of Health members on the call today. When I call your name, please indicate whether you're on the call. Dr. Noble Hanson.
Present.
Ron Broman. Good, Ron. Ed Sheehan.
Yeah.
Carol Boyce. Unmute, Carol. I know you're there. Well, we know she was there. Let me move past Carol right now. And I'm on the call. So we've got 4 regular Board of Health members on the call. And Carol, I think, is going to come in on the call today. Dr. Dick Edwards, are you there?
Yes.
Are you there?
Yes.
Okay, very good. Okay, we've got a short meeting tonight, just 3 items on the agenda. Started with one, which is a show cause hearing for Mac's Seafood Restaurant, 1291 Main Street, regarding face cover. I know all the board members did receive a copy of a notice sent to Mr. Hay, dated March 8th. Judy, did you want to comment on this before we ask to hear from Mr.
Sure. So over the summer and in the fall, I had probably 2 of people, employees not wearing masks. I had several discussions with Mac and his staff about the requirement, you know, the rules that they had to be worn. A violation in early March, another complaint, and the person sent us, it was an email complaint with photographs of not wearing a mask. So because it was the 3rd complaint, and I just didn't want to just have the discussion again have a discussion with the Board of Health about it. And I sent him a letter and invited him to this hearing today. So I think Mac is on the phone and he can tell us what's going on at his facility.
Go ahead, Mac.
Okay, thank you, Judy. This is Mac Hay. Yes, obviously, employee who was not following the rules and was not wearing his. However, just some context around this particular incident. This employee is not a scheduled employee at that location, and not actually there in a working capacity, and then unfortunately went from obviously the infraction occurred. So I would like to say, first of all, obviously we take this very seriously. We have been doing, I think, a very, very good job, especially had to close a few times this winter, which is, devastating to the business at large, as well as their paychecks every week. So, the employee certainly understands. In a way, it was really good. I do appreciate Judy bringing this forward, because there's a certain sense of gravity that this brings to the situation, rather. But I do want to say that I feel like we've done a much better job at being compliant. Couple warnings, and obviously it is now a situation that I think everybody seems to be the attitude now is that things are going to loosen up, but we're not out of the woods yet, and so I do appreciate. It's a good reminder to continue to stay vigilant.
Mac, this is John Beckley. Are you there at the store?
No, I'm there approximately.
Okay. Standard. You're not challenging the standard. You just it's the owner.
No question. We did have an incident in the summer when our kitchen staff, when it was extremely hot, and we're having trouble breathing. That's when I sort of had a questioning, what should we really do here, because I can't have my staff passing out on the line. Apply, but everybody seems to understand now that we're in a different situation, and obviously that's not is it is the rule, and it's not just the rule in Chatham.
ask Judy if there were, if we didn't, it sounds appropriate. But there was another violation, Judy. What would the protocol be then? You think?
You know, people we saw it happening, we could write a ticket, which we have done with. The other would be to bring and, I think we could issue fines as well through a hearing process. I don't know if he would know if we could do it that way, but that, that's what it would be. It would be another hearing and or revoking their permit, which I don't think
ticket
anybody
or another
wants.
cause hearing.
Right.
Yeah. Okay.
Well, I am satisfied at this point as the chair, and if nobody else would thank Mr. Hay for coming or showing up tonight and saying what you said, and I look forward to visits to your store, and being reassured when I'm there that everything is.
Yes, well, I appreciate that. And, there is a level of trust in all of this, and I appreciate the trust. And please understand that it's very seriously, and we're doing everything we can. And like I said, I'm sorry that this happened, and it is unfortunate because I think we've done a much better job, staying. It was obviously disappointing to me, and hopefully we'll learn from it and move forward. So thank you very much.
Okay. Okay, let's move on to the agenda. We have item number 2, which is a discussion regarding a state bill for reclaim agents and a request that our board consider a letter of support for the legislation which in legislature. Judy, could you just
Yeah, so this is a House bill that the House right now, local House of Rep, Commonwealth of Mass. It is in order to put the public health agents and personnel into the Group 2 retirement in the class with our first responders and police, fire, and what it does time to retirement. I think this is something that we've discussed over the years, but now with the COVID and the past and putting us all into a different category of work actually here. And then what I'm asking, I think you see the legislation basically says that you're adding after employees of Cushing Hospital, they're adding municipal directors of public health, municipal health inspectors, municipal health agents, sanitary code inspectors, and public health nurses to that category. And essentially would add 3 years to our retirement, I believe. And there's a sample letter that could be sent to our representatives. And I was just asking that the board would support this. I have already written personal letters of support as of most of our health agents, and so that's all that is.
Well, as the chair, I'm perfectly willing to support this because I believe that anything that helps strengthen the public health workforce is a good investment in a viable public health system. We want more stability of workers and more experienced workers. And to the degree that this might help encourage that, I'm perfectly comfortable supporting it, but we would have to hear from other board members on what other board members think. So other board members want to speak up and weigh in?
Yeah, this is Ron Bowman. I certainly support it too. Judy, what group are you in now in your retirement?
We're just, we're grouped in with the general, employees
Through the Commonwealth of Massachusetts?
through the
It's not like-
Commonwealth, yeah.
Yes, not through a county or anything. Okay, no, I'm in
Well,
favor of it.
right, right. We're in the state, pension program.
Okay. I'm gonna support it.
Yeah, this is Noble. Yeah, I certainly support the letter. I would just ask Judy real briefly, because I don't think people understand how your retirement system works as a town employee. It's not town funded, as I understand it.
No, it comes, instead of paying Social Security, we pay into the state pension. And then after so many years of service and age, there's a chart, and where you fall on that chart depends on how much you get in your pension. So when you're totally maxed out, it's about a minimum of 30 years and an age of 65, you get your 100% of your pension. So this would give us a shorter time period to get to that 100%. And as again, we put our money, the money comes right out of our paycheck. And there's a Cape Cod municipal group that manages the retirement fund for all the Cape Cod municipal employees.
Does the town contribute to your pension fund as well, the town or just the state?
I don't think the town does.
Right. And then, so it's police and fire, and we're adding health, and any other town employees on this retirement system?
All town employees are on it.
All town employees. Okay. Well, I support the letter strongly.
All clerical, everybody who works for a town, a municipality has to be part of the retirement system.
Well, it sounds to me like we have enough support to at least
Bob?
get a.
Yep. John, Bob has his hand up.
Okay, Bob?
Yeah, I was just gonna say, the town does not contribute to it, the state does not contribute to it. Employees contribute to it through payroll deduction, and then it goes into an interest-bearing account with the county retirement board. And that interest rate on that savings, if you will, is set by the state retirement board. And I think it's less than 1%. I mean, it's not a huge amount of money every year. So, it's really up to the employee to try to put away as much as they can if they want to have a decent retirement. And as Judy said, it's in lieu of Social Security. So just wanted to add that.
Okay.
Thanks, Bob.
Can I get a motion at least on the table from a board member to approve?
So moved, Ron
Ed
Bowman.
Sheehan,
Okay,
approve.
we have a motion from Ron to support the bill. And we have a second from Ed, was that?
Yep.
Any further discussion or comments from any board member? Anybody from the public want to comment? Okay, let me call the roll. When I call your name, please indicate how you vote on the motion. Dr. Hanson,
Support the motion.
Ron Broman,
Support.
Ed Sheehan,
Support.
Carol Boyce,
Support.
and I
Yay.
vote to
Here, here.
support. So we have 5 votes to support, nobody voting against. Judy, would you be able to prepare the letter?
Yes.
And
Yes,
then I
I can.
guess as the board chair, I guess I should sign it then? Or all
that
the,
That would be great. I'll prepare it, let you know when it's ready, and you can stop by and sign it.
is that okay with the other board members?
Yes.
Fine.
Yes.
Okay,
Yes, Noble.
okay, good. All right,
Thank you.
So
Thank
that's-
you, everyone.
you're welcome. Now for the update and discussion on COVID-19 with Dr. Robert Duncanson, Director of Health and Natural Resources. You probably have a lot of updates to give us because things seem to be very dynamic right now. So, Dr. Bob, you have the floor.
You mean they haven't been dynamic for the last year?
Yeah, right.
Yeah. Okay. So just some quick updates and all for the board and the public. Right now, well, as of yesterday afternoon, we had 11,244 cases of COVID-19 in Barnstable County, and that was an increase of 98 cases from the previous day. There were 429 deaths in Barnstable, and that was an increase of 1 from the previous day. In Chatham, as of this morning, we had 284 cases and 27 deaths. As I'm sure you've been reading in the paper, there has been a increase in cases. I'm not quite sure anybody's ready to call it a spike yet, but there has been a higher caseload in Barnstable County over the last, say, week or maybe 10 days or so. And that's reflected in that, the increase of 98 cases basically on yesterday's report, so the previous day, as well as some counts over the weekend that were close to 100 as well. If you remember a couple of weeks ago, we were down in the 20 to 30 cases a day, and now we're back up in that range of around 75 to 100 new cases a day.
Really?
The two towns with the highest case counts right now are Barnstable and Yarmouth. And both of the Barnstable and Yarmouth were in the red zone in the public health report, the weekly public health report that came out last Thursday. And that's the first time that's happened in a couple of weeks. A lot of communities were in the red zone back in late December and into, the latter part of January. And then most communities dropped back down. Chatham went all the way down from the red category all the way down to the lowest category, which is gray. And then the last 2 weeks, when the public health report came out, we have spiked back up into yellow zone, as have, a fair majority of the towns on the Cape, with the exception of Barnstable and Yarmouth that ended up going into the red zone. And that appears, Barnstable and Yarmouth right now appear to be the epicenter of a increase in cases on the Cape. And in response to that, the state did bring down a mobile testing unit to Hyannis yesterday and set up in the Cape Cod Melody Tent site to do a lot more testing, and as well, not only contact tracing, but also trying to identify whether or not there's a particular strain that is causing the spike in cases. Because you're probably aware that last week the first case of the Brazilian variant, or the P1 variant, was announced in the Commonwealth, and it was in Barnstable County. We don't have a lot of other information other than it was a 30-year-old female. Whether or not she had traveled out of the state or out of the country, that is not known at this point. So the state was, taking a serious look at that, and part of that was part of the reason for bringing the mobile testing unit down here, was to try to see if, in fact, that this increase in cases that we're seeing on Cape Cod is a result of, the P1 variant, which is reported to be by the CDC more highly contagious, was the predominant strain in the spike in cases. So I'm sure there's going to be more to come on that. So that's pretty much all I wanted to touch on there. And then just to give you an idea of where we are with some of the vaccinations, which I know is the other hot topic of the day, if you will. Let me share my screen here. And what I have up on the screen right now is the last 2 weeks of the reported vaccinations for Chatham by the state. And this is shown as percent of individuals per capita by the various age ranges. And in parentheses next to the ages is the number of people in each category as reported by the state. It totals up to about 5,600 people. It's based on the 2010 census. So it may not be a totally accurate reflection of the population right now, because as the board knows, we have a lot of seasonal and year-round people that decided to stay for longer periods of time. But this is the way the state's reporting it. This is new data in terms of reported by towns and by age. They first reported it back on March 9th, which is the graph on the bottom. And you can see both the number of, I've graphed it with both the number of people that are partially vaccinated, meaning they've received at least one of the 2 doses for either the Pfizer or the Moderna, and people that are fully vaccinated, meaning they've either received both doses of Pfizer and Moderna and or 1 dose of the J&J vaccine. And you can see, as we would expect, the highest demographic is the 75 and above, and we're close to 88% of those individuals being vaccinated, which would make sense because that's where we started with the vaccinations, and there was a lot of outreach to that age demographic. And then the next highest demographic is the 65 to 74-year-olds, which again was the second group to be opened up for vaccination under the governor's plan. And then the other demographics were still relatively low because technically, they were not eligible for the vaccinations when this data was done. This data is always basically 2 days old when the state provides it. So if the graph is the date of March 9th, it's data as of March 7th. And on the 16th, it's actually data as of through the end of day on March 14th. And the reason why you don't see any graphs for the 20 to 29-year-olds or the 0 to 19-year-olds is the state doesn't report numbers if there's less than 30 individuals in a particular range. And it makes sense for the 0 to 19-year-olds because the vaccines are not approved for anyone under 16 at this point. And for the 20 to 29-year-olds, they're not they're not an eligible demographic yet unless they were getting the vaccine by being like a first responder or of COVID facing healthcare. So they had some other reason that made them eligible. But I just thought this was kind of interesting data, but it does show, the progress that was made in 1 week in that 60 to 74-year-old demographic, where the first week we were below 50%. And now we're up close to 60% of that group having received at least one of the shots. So we'll continue to report this data out as we get it from the state. And I'm going to try to report it out in the 2-day kind of graph shown here because it makes it a lot easier to see the progress that's being made.
Bob,
And then, yeah.
I have a question. This is John. I have a question. So if you have Chatham residents that are in Florida still, and they're getting vaccinated down there, and they're not back yet, they will be not reflected at all in these charts. And
Right.
so it would be logical to assume that the coverage is at least equal to this, if not higher, for residents who may not be back yet.
Right, exactly. Yeah, this only reflects people that have received a vaccination in the state of Massachusetts.
Okay.
So if somebody, you're right, if somebody is living out of state and got vaccinated there, it would not be reflected in these numbers.
Okay.
Yep. And that's just, we work with the data the state provides, and trying to track down everybody around the country would just be a Herculean task. And right now the goal is to get shots in people's arms. And then the other figure that I just wanted to show you kind of goes back to our earlier discussion. Hopefully you can all see this figure of the average daily incident rate.
Oh, yeah.
And I just wanted to show this. This is the average daily incident rate in Chatham. As you can see, we had the spike in that late December, early February kind of time frame. And then we had a fairly precipitous decline. And then we jumped back up again. And as of last Thursday, we had leveled off as opposed to dropping back down. So this just indicates that we are seeing, a little bit of a spike, not only on the Cape, but also in Chatham. Hopefully when this week's report comes out, we'll be dropping back down again, or at least staying level and not, not increasing anymore. Because that indicates that, we're still seeing a fair amount of community transmission when this graphic kind of levels off like that. So, and then just a couple of other quick things. As I'm sure everybody knows, today, the 22nd of March, the state went into step 1 of phase 4. Doesn't have a whole lot of impact on Chatham, if you will, because most of the affected entities we don't have here. Everybody's aware of places like Fenway Park and Gillette Stadium can now reopen at 12% capacity. There have been also some changes in the gathering limits. Gathering limits for outdoor venues now have increased to 100 people. For outdoor venues, 150, and 100 people indoors for public and event settings. And for private residences, the indoor gatherings remain at 10 people and outdoor gatherings at 25. And then the other significant change that took place today was that the travel order has been changed to a travel advisory. And basically the two important take-home messages there are that the $500 fine that was present during the travel order is no longer present. So everybody is being encouraged to quarantine when they come back or have a negative COVID-19 PCR test. But they no longer are being absolutely required to as they were under the order. And just again, people that are fully vaccinated, and by fully vaccinated, we mean 14 days have elapsed since you completed your second dose of the Pfizer or the Moderna vaccine, or you've had the single dose of the J&J. So you're considered fully vaccinated 2 weeks after you finish those shots. So it's not like, oh, great, I have my second shot of Pfizer, I'm now fully vaccinated. You have to wait that 14 days before you're considered fully vaccinated. So people that are considered fully vaccinated and do not have any symptoms of COVID-19 do not have to comply with the travel order, the travel advisory anymore. And that's consistent with what the CDC has been putting out, although the CDC, but the CDC is still recommending that people do not travel unless you absolutely have to. I'm sure we've all seen some of the pictures coming out of Florida, what's been occurring on spring break and all, and everybody's very concerned that, especially now with some of these more transmissible variants floating around, that we don't go into a fourth wave, which is currently happening in Europe fairly significantly in a number of the countries there. So I think with that is a quick update. And the other thing I just wanted to mention, the other thing that took effect today is that effective today, residents 60 and older are now eligible for the vaccine. It was previously 75, then it dropped to 65. It is now residents 60 and older, as well as certain workers, and we have the link up on our website as to exactly what workers are included. People like postal employees, DPW, public health workers, and a number of other groups, restaurant workers, food service workers, workers in grocery stores, and others are now eligible to receive the vaccine. Hopefully everyone has pre-registered through the state's website for vaccine updates. You do not need to be in one of the eligible groups to pre-register. It just means that if you register ahead of time and you're not eligible, you won't get a notification. That pre-registration site is only currently for the state's 7 mass vaccination sites. So places like Dartmouth, Fenway Park, Gillette Stadium, and those larger sites. If you pre-register, when you become eligible, you will receive an email notification when there are appointments available at those mass vaccination sites. And then you have 24 hours to actually go ahead and book the appointment. Right now, it does not include appointments, say, from Barnstable County or Cape Cod Healthcare, CVS, Walgreens, and other locations. You should continue to go to their respective sites to check on their availability. Last week, Barnstable County, I think I mentioned it, well, maybe not because you didn't have a meeting last week. But starting last week, Barnstable County saw a 3-fold increase in the amount of vaccine for Barnstable County. They'd been previously receiving just over 1,000 doses a week. Starting last week, the county is now receiving 3,500 doses a week. And that's in addition to doses that Cape Cod Healthcare receives. It's in addition to doses that are being received by some of the community health centers. So Barnstable County held 3 vaccination clinics last week. They opened 3 vaccination clinics last week. For this week, 900 doses in each one. They opened up at 10 a.m. on Friday for people to book. And unlike previous incidents where, within 20 or 30 minutes, they were all booked up, this time it took about an hour and a half. So, that was a good sign that, you didn't need to be right on exactly when it opened to grab one of those appointments. But hopefully that will continue here because the county has been assured by the state that they will continue to receive that higher vaccine allotment on a regular basis because the state is receiving more vaccine from the federal government and has received assurances that that will also be continuing to increase in the coming weeks. And that's one of the reasons why the governor opened up the vaccine eligibility to a broader range of groups. So with that, that's, I think, all I want to know. I'd be happy to answer any questions.
Bob, I have one question. This is John. And that is, does anyone know what the vaccine coverage is with these new variants that are emerging, like the Brazilian variant?
The data that we've been seeing coming out of CDC and others is they are pretty good. They're not perfect. One of the reasons why the Moderna and the Pfizer, the first 2 doses out of the gate, had, extremely high efficacy rates, around 94%, was that they weren't really tested against some of the variants because when they started their clinical trials, the variants weren't really, circulating yet. The J&J vaccine, which came out later, doesn't appear on the face of it to be as efficient overall as the first 2. But one of the reasons for that was it was tested in areas, primarily South Africa, where the variants were within the population. And so, if you will, it had a higher standard to try to meet. But so far, the data indicates that, the current vaccines are holding their own against the variants. Both Moderna and Pfizer are looking at modifications to their vaccine to improve on their efficacy against the variants. So a so-called booster shot, that's still they just began clinical trials on that recently. So that may be coming out, later this year kind of thing.
Okay. Thank you.
Can I ask a question? This is Dick Edwards. About the approach to the travel orders and travel advisories. I've been aware that the Chatham Bars Inn has been extraordinarily busy over the last month on the weekends. So we've been over there a couple of times for an art show, and the parking lot is essentially full, a lot of out-of-state cars. And so there's two questions, how's the Chatham Bars Inn dealing with this? I can't believe that people from New York are quarantining at the Chatham Bars Inn. And where are these people all eating? Only a few tables in the main dining room are open. Do we know anything about that?
I can tell you based on conversations that we'd had previously with Chatham Bars Inn, they are advising all their guests that call up to make reservations at the time of the travel order. This was probably a month or 2 months ago. We had this conversation with them. On the face of it, it is personal responsibility to ensure you comply with the travel order and now with the travel advisory. Chatham Bars Inn doesn't have to force you to quarantine or anything. It's here it is, folks. This is what the governor has said. You're now responsible for complying. In terms of cars in the parking lot, I would be somewhat careful just in assuming that seeing New York or out-of-state plates in a parking lot means those people just traveled here from those states. As we know, there's a lot of people that have seasonal homes here that have been here since last year, and they may have out-of-state plates because they're second homeowners. So I think, just because you see a lot of out-of-state plates doesn't mean those people just came into Massachusetts. They may have, in fact, been here for a fair amount of time. And in terms of the restaurant, that I can't help you with. CBI we've had numerous conversations with them. Based on everything we've been told and we've observed, they have been complying with all the criteria for restaurants and dining areas in terms of social distancing and limiting the number of tables and all available. They do have multiple restaurant dining rooms around their facility. So, I can't tell you where everybody's eating because I just don't know.
Yeah, well, the restaurants are basically closed except for the one big main restaurant with only a few tables open. And they do follow, if you want to have a drink in one of their live in the living room, for example, you have to eat food with it, and they do keep everybody separated. So they are following those rules. It's just that the valets say the place is extremely busy, and I just can't. I'm just trying to figure out where these people are going because there aren't that many restaurants open out on this unless they're all just getting room service.
Yeah, they may be doing a fair amount of room service too.
That's what they're doing.
Yeah.
Anyway, they're busy.
Yep. Yeah, we've heard that from them before. Yeah.
Also, this is Judy. Also, quite a few of our restaurants in town are doing takeout, are open. So that's another possibility. Bob, did you want to talk about the homebound that we did today?
How about you talk about that, Judy? You took the lead on that.
So I just wanted to let you know that we went out today, the Chatham EMTs got the vaccine from Outer Cape Health, and we did 24 homebound people. It went very smoothly. It was a team effort between the Council on Aging and us here at the Health Department and the EMTs. Dave DePasquale and Mark Heller did a great job with their guys. So we were very happy. It went very smoothly. And then next week we have another clinic scheduled to do some of our older people at Chatham Housing Authority. So we're excited about that. We're going to do another 45 people that day. So it's all good, and it's nice to know that we can all work together as a team, and things went very well.
Very good.
Bob, this is Noble. It's been, I think, 3 weeks since our last meeting. Can can you say whether there have been any new reports of employees of restaurants or businesses that have COVID positive employees? Just as as a gauge.
Yeah, I don't believe we've had any. I think we reported on the one we had at your last meeting. So I don't believe we've had any since then.
So that would be COVID positive employees of restaurants or businesses.
Right, or yeah. Yeah, the only one that we had recently was a local dentist. But I believe we reported on that at your previous meeting.
Yeah.
And that's been the only one that we've been made aware of since then.
I don't think you did, but was that an employee or was that a contact type thing?
That was a
I
help
believe
me out, Judy. I think it was a
it was a patient.
yeah.
It was not an employee, it was a patient, and they.
Right. So they wouldn't fall under our order necessarily.
No,
they would. They
yeah,
would.
yeah, they would, but they did notify us. They did shut down, do a deep cleaning. They stayed closed for, I think, a good week. So they handled it appropriately, and there were no other cases.
Okay, yeah, and Bob, I had one other question.
Yeah.
So with the governor's new order, indoor gathering can be 100. Is that means a commercial place like the Orpheum Theater could have 100 people in there?
There are actually separate guidelines for theaters. This was the 100 people indoors is for event venues and public settings. There's a specific set of criteria for theaters.
Okay.
Elaine,
If you're interested, if you're interested, Noble, I can send those to you.
All right, that'll be fine.
Elaine
And
Gibbs?
I guess I just ask one sort of hypothetical. So in context with the state, the governor is reopening, but now there's this concern, it's very local on the Cape, this mini spike maybe. If there's been any thought or discussion about slowing down the reopening on the Cape if this spike continues?
I'm not aware of any discussions like that. As across the country, there is I'll use the phrase disconnect to some extent between, folks in the public health community versus, for want of a better term, the politicians that are in charge of states. There's two schools of thought. You're not opening fast enough, or you're opening too fast. And I think, unfortunately, this is a big experiment, and, we may see that in some of the states, where some of these variants are kind of taking hold, we may see further spikes, but, unfortunately, just time will tell. Europe is clearly getting hit with a fourth surge right now. Some of the countries over there are in dire straits, worse than they were, last fall, because of some of the variants. It's hard to say. I mean, everybody's got their own opinion. The public health folks have one. The politicians in the business community have another.
All right. Elaine, your hand is up.
Yes, thank you. This is a follow-up to Noble's question on the governor's order about the number of people inside and outside. And if I understood correctly, you can have 100 inside and 150 outside for public events and in public places, but in your home, we are still bound by the 10 inside and 25 outside. So I guess I'm trying to figure out the rationale behind that if someone wants to have a wedding for immediate family and they have 30 people they've invited that they all know have been vaccinated and they want to have it on their front lawn, they can't do that. But you can go to an event outside with 150 strangers. This is a problem I have with the governor's orders. They don't make sense. And as we go into the summer, and families are going to be arriving, I don't know how you can rationalize that private families can't have, 25 or 30 people outside for a July 4th, or if we're the ones in charge and making sure everybody's, safe. Is there a rationale for the governor? I mean, am I misunderstanding it?
No, you're correct in the numbers, Elaine. I won't even begin to try to address what the state's rationale is. We just get the orders and pass them along. We don't get asked for our opinions.
Okay, thank you.
Any other questions or comments on the COVID-19 update? If none, let's review and approve the minutes of March 1st that were included in your packet. Can I get a motion from a board member to approve the minutes of March 1st?
Approve the minutes of March 1st.
Okay,
Ed
thank you,
Sheehan.
Ed. Thank you, Ed. Can I get a second?
Second.
Okay, thank you, Carol. Any edits or corrections or revisions on the draft minutes from March 1st? If not, I'm going to call the roll. When I call your name, please indicate how you vote on the minutes. Dr. Hanson,
Approve the minutes.
Ron Broman,
Approve.
Ed Sheehan,
Approve.
Carol Boyce,
Approve.
and I vote to approve. So the minutes have been approved. We are ready to adjourn unless somebody has a last minute issue or concern they want to express. If not, can I get a motion to adjourn?
Motion to adjourn, Ed Sheehan.
Thank you, Ed. In a second.
Second, Ron Broman.
All right, thank you, Ron. When I call your name, please indicate how you vote on the motion to adjourn. Dr. Hanson,
Adjourn.
Dr. Ron Broman,
Adjourn.
Ed Sheehan,
Ed Sheehan.
Carol Boyce,
Adjourn.
and I vote to adjourn. So that's it for tonight. Thank you, everyone, for coming and participating, and thank you to Doctors Dick Edwards and Dr. Alan Ward for participating as alternates tonight. Thank you very much, everyone. Good night.